Greetings, everyone. I would like to introduce the FibroFighters and XCure's International Tumor Board. To my knowledge, this is the first and most comprehensive multidisciplinary, multi-center FLC tumor board available. We launched this program 2 months ago and are led by our new medical director, Dr. Paul Kent, along with members from XCures. FibroFighters and XCures have collaborated on fine-tuning all aspects of the project and will continue making modifications based on clinician and patient feedback. We are confident this program offers an extremely valuable tool in our continuously growing toolbox, assisting many of our patients and their families. We have already witnessed some amazing discussions leading to a shared consensus. Allow me to introduce Dr. Kent, who will be answering many of our community's questions. If you have additional questions that were not addressed, please reach out at the contacts listed on the screen. So, good afternoon, Dr. Kent. Can you please provide a brief background for anyone who may not be familiar with who you are?
Yes, hi. My name is Dr. Paul Kent. Father of 5 children and a pediatric oncologist. My background is I was educated at Harvard, then I went to Mayo Clinic for medical school, then I went to University of Chicago for residency, and then I went to Lurie Children's Northwestern for fellowship. After that, I worked briefly in Las Vegas and then 20 years at Rush University Medical Center. It was there that I met my first fibrolamellar cancer patient 5 years ago, and that led to that becoming my passion. And now I have taken a new job as the medical director for FibroFighters.
Wonderful. Thanks, Paul. So let's get started. We're going to do kind of this in a lightning round fashion. So the first question would be, what is a tumor board and why is it necessary?
Tumor board is a meeting of experts in medicine who will discuss your case, review your scans. This includes surgeons, oncologists such as myself, radiation oncologists, interventionalists, thoracic surgeons, and a patient advocate. And we're all there to discuss your case from a medical point of view and hopefully come to a consensus and offer recommendations for your home team. Your home team will also be invited and will be there as well.
Wonderful. And so that brings up who attends the tumor board typically, and can a caregiver join?
So the people who attend the tumor board are the medical experts in the fibrolamellar cancer field, which is through FibroFighters, people who have had at least 20 cases of this disease because it's so rare. And then the primary home team. This is 100% a medical conference talking about the medical situations. The family and parents do not attend. That is a multidisciplinary care meeting. That's different, something set up by your social worker that you absolutely should have. It will have everyone from the team, the nurses, the residents, the GI doctor, and so on and so on. And that's more focused on what are the questions of the patients that need to.
Got it. Okay, so the other thing is, my presenting doctor given an appointment to attend these meetings, or do they just kind of stand by and wait their turn?
Everyone gets assigned an appointment time so that we'll have a good 20 minutes to discuss your case. And this is the only tumor board in the country where we only discuss fibrolamellar. You probably have a tumor board at your local hospital where they discuss many different types of cancer and probably do 15 to 20 cases per session. So just to be clear, it's against the law for any family member to go to any tumor board anywhere in the country. This isn't something special for us. This is a separate, well-defined clinical entity to allow doctors to discuss your case with total confidentiality among themselves.
Wonderful. So what are the advantages of having multi-centers versus just those individual tumor boards, that you've discussed?
2 major advantages. Number one, of course, is you have a diversity of opinion, which is so important with people from the East Coast, from the West Coast, from major cancer institutions, even overseas. And everyone brings a different perspective and a different set of experience. You won't just be talking about your own experience in your own hospital. And the second is hopefully to avoid conflict of interest. You won't just refer the patient only to your institution. It might be that this part of the therapy should be done here, this part of the therapy should be done somewhere else.
Got it. Well, and so that brings up the next question. So since you're managing the board for FibroFighters and we're working with XCures, but you had come from Rush, do you show or have any bias? Because I'm sure our community might think, oh, well, everybody, it's going to be a Rush-based tumor board like it was for all those years, right? So what do you respond to the people that are questioning that?
Well, we have surgeons from 5 different institutions right now. One from Australia, one from UPMC, one from Tufts University, another surgeon from
New York Presbyterian, I
New
think.
York, yeah, sorry, from New York Presbyterian, right. So already, and then those surgeons among themselves, the family will know that they have all given their comments and has a chance to reach out to them. And of course, they're local surgeons as well. So no, it's not meant to have anything specifically to do with Rush.
Got it. And so, as far as XCures, what role do they play in all this?
So XCures plays 2 critical roles. They're the 3 critical roles. They're the platform from which we can do the tumor board, the virtual tumor board, show our cases, show the history, the detailed, complicated history of everything patients been treated with and what they've had in the past and what their scans showed in a way that everyone can quickly digest sometimes a history that might go on for 10 years or even longer. That's the first thing. The second thing is they provide a database so that we're collecting the database into the database, all these fibrolamellar patients now more than anyone else has in the world. And then that's how we're going to learn more, because we can use that database to ask questions. Does this work? Does that work? How often does this work? How often is surgery necessary? How often is this necessary? And so on. And the third is advocacy. And we've already seen this, both advocacy with insurance companies, but also with families and caregivers to say, this is what our data shows, and we need you to follow this. We need you to pay for this. We need you to agree to cover it.
Yeah, that's great. So now what do? We have so many patients who are out of our country. And the issue there is, at this point, XCures cannot bring them in to their particular platform because of a lot of the different countries' HIPAA regulations, et cetera. So we're calling this an International Tumor Board, which I think is important, but maybe you could explain a little bit of how we view that and how we're handling some of these patients that are overseas.
Yes, when it's a patient from overseas, we still have the same team, the same group, the same level of expertise, the same, all of that information that we share. It's, as you know, a free educational service for anyone in the world. In that case, we often need someone from the home institution to show us the scan, so they can go on Zoom and show us the scans through their own desktop and talk us through it.
Yeah,
that's really from the outside, it's the same as any other tumor board. It won't feel any different.
Yeah, no, that's fantastic. I know we recently just did one from Israel. We were helping a young man from Poland and now in Germany, and we have many patients that we're helping in Australia, and we're working on getting folks from South America and Mexico as well. So we truly do want to expand this and expand the knowledge. So that's great. So tell me, how can people sign up for this, Paul?
Well, the easiest way is just to contact me at the contact information there, email or cell phone. Text me anytime. That's always the best and quickest way to reach me. I will respond right away, and then we'll get you talk about your case and get you set up. And if the best thing for you is a tumor board, we'll set that up. And if XCures is what's right for you, we'll set that up, and we can take it from there.
That's awesome. And when are these tumor boards held, and how many patients are usually in each one?
Yes, every single Thursday for an hour to an hour and a half, and we see 3 to 4 patients. So 50 times a year times 4, we'll see between 150 and 200 fibrolamellar patients a year. And I think one of the main take-home messages is not only is there people from many different institutions, that diversity, but when we're in there, we're only talking about this one disease. We deliberately do not mix it in with other liver tumors, and very specifically do not mix it in with hepatocellular carcinoma, because it's not hepatocellular carcinoma, and we shouldn't have those as in with the same discussion.
Yeah, and I couldn't agree more. And I think one of the big takeaways that I've seen since the 2 months that we've been actively doing this program now is that many of the clinicians are actually wanting to stay on board with other cases to provide the education and the level. And I was so incredibly encouraged by a couple of the last local doctors who came out and said, do you have a problem with me joining each week? Because I truly want to learn more. And I thought, wow, that's just an added plus, right?
Yes, we love that. It's an educational resource for anybody who wants to learn more about this disease in general, or specifically your own patient.
That's wonderful. Well, Paul, thank you for taking your time this afternoon, and hopefully this has helped our patient community quite a bit. And I do encourage anyone to reach out to you with any more specific questions, because we definitely don't want to have anybody wondering, what the program's all about. So thanks again, and thank you everybody out there. You take care, everyone. Bye now.
Bye-bye.